In Fox 5 Health News, the year in health. Some of 2015's big stories included a first for women, the so-called female Viagra, and a warning about meat. And, of course, the story that is still making headlines, food-borne illness.
That's right. Joining us now, Dr. Devi Parent from the NYU School of Medicine. All right, let's talk about the food outbreaks. We've heard a lot about Chipotle, Cleveland Circle. I went to BC, that area where they had the big outbreak.
Sure. So
and they're still struggling to figure out what that was, right?
Exactly. I mean, they found some causes, like if you have a sick worker, but of course, because there have been so many outbreaks, they had norovirus, they got hit by salmonella and by E. coli also. Then you start to wonder if there's something going wrong with the suppliers, right? How the food is actually made. So one of the things that they're looking at is actually whether the soil or the water might be contaminated, where they're growing some of these vegetables or where their animals are grazing.
Because those are the things most prone to it, like the lettuce and all the sort of stuff you put on Mexican food, tomatoes.
Exactly. So if you wash your lettuce or wash your fruits and vegetables, you can clean whatever dirt or bacteria might be on the outside, but not in the inside. Think about how much water is in a tomato. So they still don't know exactly what's causing the problem, but it seems that they are working hard to change their food practices.
Right, and the company being clear about that, we did a story, they're putting in their strict new guidelines for how they cook and prepare the food in an attempt to
geez, though, they might have to make some major changes if it's a soil thing or if it's where they're growing their food.
Exactly, because they're famous for actually using fresh foods, right? Fresh ingredients, but the more fresh you get sometimes, the less likely you are to be able to control things like this.
That is the downside of that. All right, we saw female Viagra.
That was huge this year in the news.
Except it wasn't at all, right? No one bought it whatsoever. And it's a misnomer to call it female Viagra because it works completely different than male Viagra and the whole thing, right?
True. So actually, I think that moniker female Viagra helped them when they went before the FDA. They've been rejected twice, right? But having that title kind of helped them in the sense that over 20 drugs have been approved for men for erectile dysfunction, sexual dysfunction. This was the first one coming up before the FDA that got approved for sexual desire disorders in women. So I think it helped them then, but the problem was that afterwards, you know, it actually doesn't work like Viagra. It's not something that you take right before you want it to work, right? You take it every single day, and I think for women, for most women, they don't want to take something every single day, and especially with the side effects of lightheadedness.
And then you can't have a glass of wine or anything.
That was the big problem.
That doesn't match up.
Risk-reward ratio was all off there.
All right, so this one really upset me. I know you probably feel the same way, but the red meat and the talk that it could be, you know, carcinogenic, but...
Sure. The World Health Organization came out. They said they actually grouped it in the same category as smoking or tobacco in terms of its carcinogenic risk. But the thing is that, you know, that was in terms of the evidence, right? So smoking, obviously tobacco, we know about a lot of the different problems that causes. I wouldn't put red meat necessarily in that category, but it was still a shock that they were looking at the evidence in the same way. And they were focusing mostly on processed meats, but they also looked at pork, which we normally think of as maybe more healthy.
Yeah. Do you have to eat so much of it, though, for it to have an impact? Because, you know, people don't want to give up their steak on a Saturday night.
Sure, exactly. Well, they were looking at whether people are having it multiple times per week, but the other thing is it was a proportionate increase in terms of your cancer risk. So if you have very low risk of developing cancer to begin with, then it doesn't really matter as much if you're having meat or not having meat. But if you have a high risk, let's say of colon cancer, then you may want to avoid having as much meat.
All right, and talking about preventing heart disease, we saw them sort of move towards taking greater steps for people younger than we thought of before.
Exactly. So in the past, we used to think if people's risk factors were higher, if they had a higher age, for example, previous heart attacks, then they should be on things like statins. Now they're actually looking at just redefining the whole guidelines for being on statins. So people who are as young as 40, who have even 10% risk of having a heart attack down the road or even have high cholesterol, to actually start the statin versus start with a diet and exercise and then monitor.
Busy year as always. All right, Dr. Devi, we appreciate it. Have a good new year, and we'll see you back here in 2016. All right.
Thank you.